Now we're live. Hello, everyone. Meaghan from Toronto Family Doulas here. You can see my very sexy get up here, but we are making sure that we are following safety. I'm here with Michiko.
Hi.
And you are going to have a pelvic floor physio assessment right along with me today. I'm probably insane for doing this, but I wanted to take the mystery out of it for everybody because I have been recommending this for years, and it was probably time to put my money where my mouth was. So I have been with Michiko for about the last hour. We sort of sat down, we went over my medical history, we went over my concerns, we talked about my births and how they sort of impacted my pelvic floor health and how things went just for me, generally health-wise afterwards. And then Michiko took me through a whole bunch of stuff. She has a way cooler pelvis model than I do. I'm kind of jealous of her pelvis model. And then she actually started to do my assessment. We wanted to sort of get a handle on what was happening down there. And then we're going to go through a little bit of it again. So one of the things that Michiko found when she did my first assessment is that my left side of my pelvic floor and the right side of my pelvic floor have different challenges. And that was actually something, I'll be honest, I had no idea was a thing. So I'm going to lie back. You're going to get a really attractive view of my face from there, but we're keeping this PG. And I'm going to probably repeat a lot of what Michiko is saying and asking me to do. And then I'm going to talk everybody through how it feels. If you have questions, make sure you type them and we will see them and we will answer your questions at the end. So Michiko?
Yay, we're ready.
Let's get started.
Yeah. Okay, so I'm just getting some gloves on. And we've already talked about the risks and benefits. So we're going to go proceed. Are you okay in providing me with consent to do an internal examination?
Yes, we can do an internal examination.
Okay, all right. So first, I'm going to look at the do an external observation. So we're going to look at the skin health. We're going to look at the musculature of the outside vulvar region. And then I'm going to also ask you if you have any numbness or tingling or any kind of weird sensations down there. And you just have to keep on communicating with me throughout the whole process. Okay?
Perfect.
All right.
So in case anyone couldn't hear what Michiko was just saying, she's about to do sort of an external just look and see how everything looks in terms of skin and muscular and tissue health. And she is going to sort of touch and see if there's anything that feels numb or tingling or even just a little off or weird so that if there's anything happening, she can see.
Okay, so I'm going to touch your pubic bone now, okay? And tell me if you feel any pain.
No pain on my pubic bone.
Okay, all right. Down your right side of the vulvar region, do you feel any numbness, tingling, weird?
No numbness, no tingling, no weirdness.
Okay, left side?
No numbing, no tingling, no weirdness on the left side.
And then we check your reflexes on your, if it's you have a strong anal wink, so that's good.
Strong anal wink. There's a phrase I never thought I was going to say live streaming on Facebook. So just in case anybody is wondering what that is, all Michiko did is touched the skin on either side of the anus. It was not an internal exam. She didn't put her finger in my butt. Just if that's what people are worried about or questioning, it was not painful. It didn't feel uncomfortable. Honestly, it kind of feels like someone grabbing or poking at my butt.
Okay. And then what we're going to do is we're going to separate your labia and we're just going to look at the health, okay, of the inner labia. And then it looks really good. So what I'm going to do is I'm going to place the finger right at the 6 o'clock, which is we're going to think of the vulvar region and the vagina as a clock. So near the pubic bone is 12 o'clock and near your rectal area is 6 o'clock.
So just in case anyone can't hear, I'm going to repeat lots of what Michiko is saying, which means you may get it twice. But she's sort of talking about looking at the vulva in terms of a clock. 12 o'clock is sort of the top, which is closer to your clitoris, and 6 o'clock is the bottom, which is the perineum. So right now, Michiko is sort of touching very gently around 6 o'clock, the base of my perineum, or the base of the vulvular opening. And for those of you who have had kids, you know this is where tears happen. This is where episiotomies happen. I've had both. So, you know, there is potential for things like scar tissue in that region that for some people cause pain during intercourse or just pain generally. So that's one of the things Michiko is checking for right now.
Yep. And then now my finger is inserted into the PIP joint, which is the middle joint of your finger, of my index finger.
So
right
that much finger.
Yeah. And then what we're going to do is we're going to slide the second finger in and we're going to piggyback it in. So we're going to piggyback the second finger and then slide it in. And then it's going to go side by side.
So now it's like this.
Yeah. And then what we're going to do is we're going to check the resistance by doing a V.
So she's doing this on the inside of my vagina. This is for, again, for anyone who's given birth, this is kind of very similar feeling to a cervical exam, except there's no pressure downwards from a baby. So it's actually a lot more comfortable than a cervical exam.
And then what we're going to do is we're going to actually insert the fingers a little bit further to the MCP joint, which is the knuckles. And you're going to curl the fingers down because that's how the musculature actually is done. Like that's the anatomy.
There you go.
Okay. And then what I'm going to ask Meaghan to do is, Meaghan, can you imagine like a straw inside your vagina and you're going to suck up a smoothie towards your head? Good. And relax. So now this time I want you to relax your abdomen and relax your butt cheeks as much as you can. And really think about it internally. So take a deep breath in. As you exhale, think of the musculature raising up. Good. And then hold it there for 10 seconds. And
this is the hard part.
2, 3. And what does it feel like? It's a little shaky.
It is a little shaky. Now, I'll be honest, Michiko has already done this to me a couple of times.
Yeah.
So those muscles might be a little bit more tired than they were an hour ago.
Good. And release.
But they're definitely shaky. And I can feel how it's kind of like being at the gym where you know you're pushing yourself just a little bit further than you have in the past. And so things are a little bit, they almost feel weak.
Good. Okay. So now we're at 6 o'clock. So now we're going to go around to 5 o'clock, 4 o'clock, 3 o'clock. And what I'm doing is I'm just moving my fingers inside to the around the vaginal wall to feel the tone of the muscles. And then what we're going to do is we're going to actually do some coordination too. So I feel on the left side, when we go to 7 o'clock and 8 o'clock, I feel some like a little bit of tension there. And how do you feel, Meaghan?
I agree. So what Michiko and I talked about before is that I have endometriosis and was diagnosed as a teenager. And historically, it's been concentrated more on the left-hand side. So whenever I feel pain or discomfort, or even just like bloating, swelling, any of that associated with my cycle, all of it seems to be concentrated on the left-hand side. And now as Michiko sort of examined the right side, it felt not so bad. On the left side, it feels like a tense muscle. Like it feels like there is resistance, almost as if I was doing a hamstring stretch, and I can feel that end point. It has that sort of tension and that tightness as she's examining what she's calling sort of 8 and 7 o'clock. So, or 7 and 8 o'clock. So sort of in the bottom quadrant of the left side.
Yeah. And then now what I'm doing is I'm kind of treating you at the same time. So I'm doing something of like a massage or like a tender point release. And we're going to see if this will help a little bit.
So very different massage than I would normally be getting right now. But she is actually working that muscle and I can feel it. It's very similar actually to how sort of a massage over a knot in your back or your hamstring or anywhere else would feel. Although Michiko is being way more gentle than my massage therapist is. So she is very gently sort of working that muscle and helping to ease some of that tightness in that sort of knot feeling.
Okay, so we already did a lot of strength testing, but let's do the coordination test again.
For sure.
I want Meaghan to give me a big cough. Good. Okay, so now I want you to imagine sucking up that pelvic floor up, lifting it up towards your head, and then holding it there, and then coughing.
Okay, so Michiko and I talked about this before, and I'm really bad at the coordination of it. So I breathe out.
As you exhale, bring up the pelvic floor. Now give me a cough. Good, much better. So that support system for your bladder and your organs is much necessary for when you increase the intra-abdominal pressure. So when there's a cough, a sneeze, a jump, anything, it pushes down and you need a counter pressure. So that coordination is necessary.
So this is for all of you folks out there who snissing is your reality. This is exactly what we're working on right now, is being able to sort of brace and maintain that pelvic floor when there's that abdominal pressure coming down. Coughing, sneezing, as Michiko said, jumping, any of those things. So that's what this is helping to work through and correct.
All right, so now I'm going to actually release.
I didn't, but there we go. My video cut out for a minute. So no, Michiko removed her fingers. She did the release. It didn't hurt. There has been, I want to make sure everybody is aware, no pain whatsoever at any point in this exam, either before we came on or after. There's definitely a few moments that have been uncomfortable, and I have a very high pain tolerance, so it could be that for some people that might be a really low level of pain, but Michiko's rule is nothing over a 5. So no pain, no sort of debilitating. You're not going to walk out of here wondering what you were thinking. It's very, very gentle. It's very, very easy. At no point am I like gritting my teeth or digging my heels into the table. Everything feels fine.
All right, so
perfect.
So we are done, and then we can talk about treatments a little bit.
Yeah, let's talk about treatment plans, Michiko. I'll
Okay.
see. Here we go.
Okay, so you know what, Meaghan, you had such good strength, really good endurance. So, but the thing about it is the coordination. So it's not coming on at the right time. So, you know, the pelvic floor needs to lift. So what I would do is a lot of functional training exercises, such as even lifting your children, or, you know, like lifting up anything from the ground or standing up from a chair. I want you to really think about contracting the pelvic floor before you make an effort, before that intra-abdominal pressure increases. It comes with time. You have to practice it, because it didn't come overnight that you lost that coordination. So it has to come back, and you got to work on it, not overnight, but continuously. And it will come with time. It's just, it takes a little bit more time than usual. But you,
of course, I have the one that takes the most amount of time to fix, right?
Yeah.
Now, one thing I wanted to talk about, because you made the comment, my massage therapist, my chiro, everybody knows that this is an issue with me, but I would never have thought about it in terms of sort of pelvic health. And that's my IT bands and the muscles sort of in the lower pelvis, and stretching those, and how tight they are and how connected they are to everything.
Yeah, for sure. So, you know, like a pelvic health physiotherapist is essentially an orthopedic physiotherapist too. So we have to look at the whole body and how the body, in all the body parts work together. The pelvic floor is not an isolated muscle. So what we need to do is we need to assess how your hips are moving, how the lower back is moving, because the pelvic floor is really, really, research shows that there's some relation, not a causation, but a relationship between your pelvic floor and other muscles around your hips and your back as well. So what we did is, after tender point releases, we did a lot of stretching to ensure that we maintain that stretch a little bit when you go home.
So apparently I have homework when I go home. So I hope that this helped everybody. This week is obviously a little bit of a shorter episode because there's only so much I am willing to do while live streaming. But hopefully this took a little bit of the mystery out of it. I promise everybody, it was not a big deal at all. I've had babies. I've had people's fingers in my vaginas before, or my vagina before. Not a big deal. Michiko is like the sweetest, least intimidating person I have ever met in my life. And she will take very good care of anybody who comes into her office. Just in case people are worried about doing this now, I'll sort of go over, my mask is losing it here, but I'll go over some of Michiko's safety protocols, because I know that that's a really big concern right now, especially for folks who have brand new babies at home or young babies. I'm high risk, so I avoid like going in public like the plague, literally right now. So Michiko sent me a screening test, or screening questionnaire this morning before I even came in. I wore my mask my entire time until we had to hop on live, and then I switched to face shield. Obviously, everything was sanitized before I came in here. Just like in a doctor's office, there's paper sheets on the table, and I'm covered up with a paper sheet, and everything will go in the trash. And I'm the only one here, so it's nice and quiet, and I'm not running into other people. So everything is safe and clean and perfect in terms of sort of the pandemic protocols and what we need to do to stay safe there. And really not a super big deal. And hopefully this helps with some of that sort of lower pelvic pressure and even some of that hip and lower back discomfort that I feel on a daily basis. I really hope this helped everybody. I hope you enjoyed my experience and this 15 minutes at my expense. But I really do hope that it sort of eased any questions or concerns you may have. You will probably be seeing a nice little link in the bottom of our screen. That's to sign up for our newsletter, and there will be a handout courtesy of Michiko with all kinds of tips and tricks for your pelvic health. So make sure you are signing up for that. And if you're not following us over on Instagram, make sure you hop on over and follow us there. And make sure you're following Michiko as well. She is tagged in all of our posts this week about pelvic floor health. Thanks for joining us, everybody.